I just wanted to mention diabetes also. You know, poorly controlled diabetics, they usually tend to clog up the arteries. You know, diabetes is a risk factor for heart failure, preserved ejection fraction. Remember I said there was heart failure from the weak heart muscles? Now there's also, now with more people living longer, we're seeing more and more heart failure with preserved ejection fraction. One of the risk factors there is severe lung disease, like COPD, and diabetes mellitus. These are patients who may have normally pumping heart and still have heart failure. The pathology for heart failure preserved ejection fraction is vascular endothelial inflammation, and diabetes is a contributor to vascular wall inflammation that makes the circulation compromised, that leads to heart failure preserved ejection fraction. Obesity is another one that goes with diabetes. Remember how I said obesity, how the heart has to carry that weight. If you're like 350 pounds, for every step you make, you have to exert energy. If you're 150 pounds versus 300 pounds, you spend more energy taking that single step. Well, the heart has to pump blood with that energy, you know, to circulate the blood and to move and circulate it. So the heavier you are, the heart has to work harder. That's why we see heart failure in morbid obesity patients. And then the other topic I want to mention is sleep apnea. I think Jeremy talked about that earlier. So sleep apnea is a very important topic nowadays. They present with fatigue, lack of energy, and that's why I always talk to patients about sleep apnea. Those who come to my clinic will notice that I talked about sleep apnea. It's because the consequence of sleep apnea is congestive heart failure. If you don't sleep well, and I'm sure Jeremy talked about it earlier, what are the associated complications of sleep apnea? Number one, increased risk for stroke. Number two, increased risk for heart failure. Number three, increased risk for cardiomyopathy with sleep apnea. Also with sleep apnea, the blood pressure becomes difficult to control, which can lead to heart failure also. Also with sleep apnea, you're prone to atrial arrhythmias. Atrial arrhythmias because the heart and lungs not getting enough oxygen. And then how do we treat the last lifestyle changes? We talked about losing weight, controlling sugar, exercising, medications. Well, these are what we call your physicians will give you. They give you ACE inhibitors or blood pressure pills like ACE inhibitors, beta blockers. They help relax the heart muscle. We talked about that stiff heart muscle earlier, and then cardiac rehab is another way of helping heart failure symptoms. And then we have devices here. We have cardiac defibrillators. Cardiac resynchronization therapy is when we put 3-lead pacemakers because we want to synchronize the right and the left side of the heart. But these are different. This is not a regular pacemaker where you have 1 or 2 leads. This is when you have 3-lead pacemaker, and they know it helps heart failure. LVAD or ventricular assist device, these are like pumps attached to the tip of the heart that pumps blood back to the body. It's basically, it's like having an extra pump, helping your pump because your pump is so weak. These are used in pre-transplant. We used to use them before as a bridge to transplant. Now we call it destination therapy because it's a destination to treat with the ventricular. In other words, because we don't have enough transplant donors, so they use the LVAD as a destination, which means they're going to live that way the rest of their life with an accessory pump attached to their body, basically. Heart surgery, if you need bypass to improve circulation, transplant, as mentioned earlier, percutaneous coronary intervention or angioplasty, and bypass. The point of 6 and 7, bypass and PCI, is just to improve if you have blockages, you improve circulation to your heart muscles. So the heart muscles are pumping stronger and won't weaken. So, in other words, you fix the plumbing and then the pump gets better. Okay? Fix the plumbing and the pump gets better. Just think of it that way. Does that make sense? If the plumbing is working good, then the flow of blood is better. Just like the house. If your plumbing is good outside, then everything circulates well inside the house, the water. So, and then valve replacement. If the valve is, you talked about that earlier. If the valve is bad, then that's one of the things to replace is the heart valve.